Hey everyone, Dr. Ryan, physical therapist. Today I'm going to talk to you about dosing resistance exercise with blood flow restriction training. Previously, we've talked a little bit about this when we were talking about how pressure and load are a continuum, but we're going to dive a little bit more into the actual resistance portion itself. So, I'm sure you have seen many people talk about the lower extremity. For your limb occlusion pressure, you need to be at 60 to 80%. And most people also know that a typical rep scheme for BFR is 33 by 15 with a 30-second rest in between. Most people, though, when they're doing blood flow restriction training and you ask them about it, they're just throwing out, okay, we're going to do 80%, more pressure must be better, and we're just going to do that. And a lot of people are doing that with bands or not really much weight at all. Most people are actually underdosing with blood flow restriction training as well. Throwing BFR at a problem will not solve it, especially if you're not doing it in the right dosage. So we need to make sure, just like with any other exercise, that we're dosing blood flow restriction training effectively as well. If we're in this range, ideally, we should also be doing 20 to 40% of a 1 rep max for the actual load itself. So this is the pressure, but we should be doing 20 to 40% of a 1 rep max for the load. Now, if you're for the first few sessions less than this, that's totally fine. A lot of patients can't tolerate this right away. You need to ramp them up to that in order to be safe and not get them to the point of failure and cause them injury. But ideally, once we're at that effective range, that's going to be considered that 20 to 40% of a 1 rep max and somewhere in the 60 to 80% limb occlusion pressure. Watch that video on how both of these are related and how those kind of work together. So in order to find a 1 rep max, a lot of people are like, well, how are we going to do that if someone's in pain or they're post-op or things like that? And that's a valid question, but there are a lot of 1 rep max estimation calculators out there. So a lot of people, although they can't necessarily tolerate doing a 1 rep max test, they can tolerate doing an estimated 1 rep max test, which is essentially getting to the point of failure within 10 reps. So if they can do a heavy weight that they're going to fail within 10 repetitions, you can accurately predict, within a certain percentage. I don't know what that is off the top of my head, what their 1 rep max will be. Just put this into a 1 rep max calculator. So say they did 7 at 100 pounds, this will spit out a number. And then we're just using that number, taking a percentage of that to get that, that goal that we're shooting for the resistance exercise for the lower extremity in this example. So if they still cannot tolerate this, then typically I'm trying to do this on the opposite limb that is non-painful, and we're using that as a goal to shoot towards. So it's not perfect, but in a post-op setting, we're not going to even push someone this much early on in their care. So maybe we're going to do that on the other leg, and then we're going to say, okay, maybe 100 pounds is their 1 rep max on their non-surgical leg for a certain exercise, or the estimated 1 rep max, which would be 20 pounds would be that effective threshold that we're shooting towards. But that person maybe can only tolerate doing 4 pounds with BFR right now. That's fine, but we're working them up towards this range. Once they get towards this range, they likely will be strong enough that you might be able to retest them on that surgical limb to make sure that we're being accurate. But again, that's going to depend on their postoperative status, their pain, all those different things. You need to use your own clinical judgment for that. Again, this is not medical advice. This is just for educational purposes only. I hope you found this helpful. Please comment with any questions, like the post, and subscribe to the channel. Comment below with anything else that you would like to see in future videos.